friends, welcome to my channel. Today we will discuss about the pediatric history taking and the vision assessment. So very basic history taking that you should always ask in your clinics when a mothers or parents or fathers are coming to in your clinic that present complaints. Nowadays due to the pandemics and after pandemic lots of screen times are day by day increasing. So basically general complaints to the parents that their babies or their child cannot see for distant visions. They are seeing the blurriness of visions. So our first question is that whether the blurriness of the vision for monocularly or binocularly, and since how long you are seeing a blurriness of visions, or if any kind of focusing problems is also there or not. You can also ask whether blurriness of vision for distance or near. So such kind of the problems questions you should ask to the parents, or sometimes parents used to bring that their baby's eyes are getting a deviating. It means squinting eye. Whether the squinting may be outward or inward, you should always ask if it is associated with a squinting eye, whether squinting is a constant, or sometime it is seeing squint, sometime it is not seeing squints, or it is day by day increasing more. You should also ask along with any kind of associated symptoms which is related to the problem. Also you should always ask to the parents. Along with that, past ocular history, if baby is wearing a glasses or not, whether the baby is or child is doing patching. It means patching means to say that some nowadays if vision is not improving, so we are suggesting a patching. That means we cover one eye and or bad good eye and helps to improve the vision for bad eye. So this is called a patching, whether patching is an alternative or one eye patch. Along with any kind of ocular exercise whether your child is doing or not, such for example in those who are basically doing a convergence problem and an accommodation related problem, any kind of exercise that he or she is doing or not. Next is a past medical history. In a past medical history we should always ask to the parent that whether seizures happens to your baby or child or not. It we call also a feeds, whether the feeds is are under control or not. Next is a development milestone. It means to say that since from birth to 1 year of the baby, how your baby's developments, whether global development is within the normal or not. Due to the some seizure, the baby brains get damaged, or due to that your developments of the baby will get a delay, neck holding, they cannot walk properly, they cannot give a proper eye contacts. So very most important, you should always ask to the whether the baby's developments are proper or not, whether milestone is a proper or not. Next, whether any kind of medications he is taking or not, since how long he is taking. Along with that, any kind of supportive therapy like such as OT means occupation therapy, PT means that is a physiotherapy, speech therapy. This all this therapy which is related to the some seizure. If nowadays I have seen some more and more cases that if babies are getting a seizures constantly, so due to the some seizures the baby development delays are gets means hamper. So because of that babies requires supportive therapy like a occupation therapy, speech therapy, and physiotherapies. Along with that you should always ask the family history. Very is a very most important things, with a marriage in a blood relation or any kind of ocular disease within the family or not. Next is that you can see in this chart I have divided into four groups. Next that first is full term and preterm. In a full term you should always ask the gestation of age and birth weight. Next is a prenatal factor. We should always ask after the birth any kind of infections of a baby or not. Next is the prenatal factor. In a prenatal factor, you should if you should always ask to the parents with the Afghan scoring is, or the after the birth the baby colors and breathing and all this in problem within the or normal or not. After the postnatal factor, any kind of oxygen related problem or phototherapy problem, any kind of blunt and trauma of after the birth happening or not to the baby. the full form of the torch which is given here. Along with that, what are the ocular complications which is related to the torch is also given here step by step. The next is a vision assessment. That in a vision assessment which is given here from the 1 month to the till the age of the 5 years, that how you can perform in the neonatals, infant and toddlers, preschool and school going. Thank you, my all my friends. So please subscribe and share my channels for more updated videos.